I'm Sahar Bedrood. I'm a glaucoma specialist working out of Los Angeles, California at a practice called Advanced Vision Care. And I am really happy to be here on behalf of Elios Vision to talk a little bit about this new technology that is for the treatment of glaucoma. These are my financial disclosures. Glaucoma is a very common disease. Cataracts are also a very common disease. In cataract surgery, we do about 32 million of them a year, and about 20% of those patients have either glaucoma or ocular hypertension. So that accounts for about 6 million a year that can have a combined procedure of glaucoma and cataract surgery. Oddly, though, only about 30% of that 20% are getting that actual treatment. The mixed space, as you all know, is very robust right now. There are so many people trying to get innovation and devices and lasers into that space. And Elios Vision has basically the excimer laser technology to help also create a new innovative technology into that space. What it is a console that is attached to a handpiece. The handpiece is very similar to a phaco device handpiece that is easy to use for the surgeons. It's efficient. It goes through the main wound, and it creates an implant-free microchannel along the trabecular meshwork. There's no thermal energy because it's an excimer laser, and there's no mechanical stress to that angle, and I'll explain in the next slide why that's important. And it's a pretty rapid learning curve. I had the opportunity to train on it and get hands-on experience with patients on this, and I felt like it was very easy to learn. Why is this technology important? Right now, we have a lot of different things that we can do. We can do goniotomies, we can do bypass, we can do canaloplasty. What we have learned through the work of Murray Johnstone is that the angle has a purpose, it has a function. It has a pulsatile flow and movement. It's not just an empty space or a sponge-like network. It actually responds to pressure. And based on this image, you can see that the blue is a network of trabecular meshwork. It responds to increased pressure, and it actually moves valves and opens up into the Schlemm's canal. So totally destroying that is really probably not a good idea, but creating channels or openings to have aqueous flow through it may be a better opportunity for IOP lowering long term. What the microchannels look like are basically 210 micron cuts into the trabecular meshwork. It doesn't go all the way through to Schlemm's canal. It actually just creates avenues and channels into the trabecular meshwork so that there is flow from the anterior chamber to Schlemm's canal. Data supports IOP lowering sustained out to 8 years with favorable safety profile. So here's an example of the procedure. There's a foot pedal, so you place the actual probe right up into the TM, and as you press the foot pedal, the excimer laser will give about 1 to 2 seconds of laser and create these microchannels. And you can do this up to about 10 channels across the angle. And if you see through INA, you can see that there's flow and basically flushing of the vessels, maybe indicating that there is more flow through that area of the aqueous. The procedure is relatively straightforward and broadly adoptable by both glaucoma surgeons and cataract surgeons. So the clinical data, there are about 20 clinical studies, around 2,300 eyes that have been treated, and the IOP reduction in these studies have ranged from 29 to 43% IOP reduction and about 47 to 61% medication reduction. And it can be combined with cataract surgery, and it can be a standalone procedure. They're making significant steps to developing this. Few of the things that I wanted to cover before I end is that there are FDA pivotal trials for the combination procedure, and there is an estimated launch of early 2025 for the device and the procedure. The FDA standalone study is also underway in 11 sites in the US. They already have CE mark in Europe as a combination and a standalone procedure. And right now, the randomized control studies are being enrolled in Europe, and the first patients are being treated. Because as we know, we love data, and I think that that's necessary, and that's already underway. And the company is headquartered in Irvine, and the device is manufactured in Germany. And with that, given my own hands-on experience, I think this is a really exciting realm. I think lasers in general in the next few years are going to make a comeback. And I'm excited to continue to learn and talk about this in the future. Thank you.